Welcome to the Dip Dive. Today, we're digging into some source material about a specific educational book.
Yeah, sold 100 Questions and Answers in Pathology by Dr. Atef Ahmed, aimed at medical students.
Right. And our mission here is just to unpack what this text says about the book.
Exactly what it is, who it's really for, and why the source material suggests it's a good resource if you need to get up to speed on pathology efficiently.
Like a shortcut to understanding the key info. Okay.
Yeah.
So the source presents it as this, well, meticulously crafted guide, Q&A format. Sounds interesting for cutting through complexity. Let's jump in. What does the source say this resource actually is?
Okay, so fundamentally, the text describes it as a guide for medical students. The whole thing is structured around questions and answers.
And the goal is
The stated goal is to really deepen understanding of pathology.
not just surface level. Does it cover a lot of ground, or is it specialized?
The source highlights that it's comprehensive. It hits general pathology, but also the specialized subdisciplines. So pretty broad.
Okay, broad coverage. Now, the text seemed to make a point about the questions themselves. They aren't just like flashcards.
Right. That's crucial according to the source. The questions are apparently curated specifically to, well, enhance your understanding.
Enhance how?
And the answers aren't just yes or no or a single word. The text says they give you detailed explanations, the rationale behind the answer.
Ah, the why.
Exactly. And even mentions bringing in current clinical guidelines, so it connects the dots.
That sounds much more useful than just rote memorization. The source also mentioned it being practical and up to date.
Yeah, it stresses that. Reflecting the current medical curriculum, trying to bridge, pure theory with what you actually encounter in practice.
Makes sense. And Dr. Ahmed's explanations, the source had something to say about those too.
Described as thought-provoking, clear, concise,
Yeah.
engaging. The idea is simplifying complex stuff so it actually sinks in.
So it's definitely framed as being great for exam prep for med students.
Yes, tailored for that, the text makes that clear, but it also positions it as more versatile.
Oh. How so?
Well, the source suggests it could be a dependable reference during, say, clinical rotations.
Okay.
Maybe even something you keep coming back to later in your career. It implies sort of lasting value.
Interesting. All right, so why this book specifically? The source seemed to put some weight on the author, Dr. Atef Ahmed.
It does. He's described as a renowned educator, and the implication is his experience really shapes the book.
And there's that recurring theme again.
Right. Bridging basic science and clinical practice. Preparing students for, actual patient scenarios, not just ticking boxes on a test.
And it's not just about absorbing facts, is it? The source mentions skill development.
Exactly. It frames it as a way to foster critical thinking, analytical skills, the kind of abilities you actually need as a doctor. It's presented as a pathway to really mastering the subject.
So if we connect this back to you, the listener, maybe wanting to get informed efficiently, this source describes a resource that's designed to cut through that complexity.
Yeah, offering those potential aha moments through its format. Clear explanations, active learning through the Q&A.
It really seems geared towards distilling a lot of information effectively. Okay, so wrapping up our look at this source material, it positions this 100 Questions book as, well, comprehensive, practical, engaging, using that Q&A format to build real understanding and critical thinking for exams and practice.
And, thinking only about what the source presents, it does make you consider something.
Go on.
How might a resource built entirely around answering the why and constantly linking theory to practice through this kind of dialogue format, how might that fundamentally change your approach to learning a really dense field like pathology?
Moving beyond just memorizing facts.
Towards actual understanding and critical application.
Definitely food for thought. That's our deep dive for today.